3 minutes so we can accommodate everybody else that we need to hear from.
Hi, my name is Jenessa Lea, and I'm a resident of North St. Paul, Minnesota. I'm a 27-year-old mother to a beautiful 7-year-old little girl named Reagan. Reagan and I have a genetic illness called Ehlers Danlos syndrome, or EDS for short. I have as well been diagnosed with the following secondary illnesses: generalized hypermobility of joints, joint pain, arthritis in multiple sites, osteoarthritis in multiple sites, myopia, vitreous degeneration of the eyes, variant migraines, muscle weakness, neuropathy, vitamin D deficiency, Raynaud's phenomenon, degenerative disc disease, depression, and anxiety. EDS has a great impact on our musculoskeletal system, digestive system, urinary system, has heart involvement, as well as neurological symptoms. The reason it is so widespread is because we have a defect in our collagen. Collagen is 90% of your body. It helps tissue resist deformation. Collagen is an important contributor to the physical strengths of skin, joints, muscles, ligaments, blood vessels, and visceral organs. Abnormal collagen renders these structures more elastic and therefore weak. Depending on the individual, the severity of the mutation can vary from mild to life-threatening, and there is no cure. Imagine a life where your joints are constantly popping in and out, yes, dislocating, subluxating, and hyperextending. And every step I take, my knees are go 15 degrees past the point they're supposed to. My ankles, wrists, fingers, SI joints, neck, elbows, shoulders also hyperextend, subluxate, and dislocate daily. For myself and other EDS patients, this is our reality. As you can imagine, the simplest of tasks become not so simple. This is a very debilitating syndrome, and I have lost the ability to earn a living due to my illness. I had lost hope for many years and didn't care if I lived or died. I was in so much pain. Cannabis is the only way I manage my illness and pain because I will not subject my body to the harms of taking narcotic pain medicine. No one can realistically live a good quality of life being on long-term and high-dose narcotics, in my opinion, and my life experience. The decision to only medicate with cannabis was one of the best decisions I made for myself. Cannabis alleviates pain. It is an antioxidant, anti-inflammatory, neuroprotective, and a neuroprotective. Cannabis helps in many health issues that stem from EDS and help control pain. It really is a win-win situation. I need to have safe and non-criminal access to medical cannabis, which includes being able to safely grow my own medicine. Cannabis cultivation was in the bill and was the sole means and only way for indigent Minnesota patients and their caregivers to medicate in medical need of cannabis, an easy way to afford the medicine that we need to stay alive. Federal law prevents coverage of cannabis through Medicaid, Minnesota Care, and Minnesota Assistance, or Care and medical assistance, and patients receiving $400 to $957 a month on disability cannot afford $250 to $500 a month in medical cannabis. The cannabis cultivation was removed from legislation, and it's a little disheartening as I wouldn't be able to afford my medication, but it would be legal for me to get. Frustrating. I would hate to see all the hard work and efforts leave out a vast majority who would be legally allowed to buy cannabis, but for financial restrictions, cultivation restrictions, and lack of insurance coverage would just cause more pain and stress. Pain, disease, and illness do not discriminate by income. Unfortunately, becoming ill is unpredictable and extremely stressful. My health conditions are already so stressful and exhausting. Do we really need to cause more pain, frustration to those who are suffering? I ask you, please add Ehlers Danlos syndrome to the qualifying list of illnesses that are covered under this bill so we are protected patients, as well as the ability to cultivate and grow our own medicine. I understand people's concern for cultivation in your own home, but I believe that we can come to a compromise on this like other states have. I know that I wouldn't jeopardize my lifeline, that is cannabis, to try to grow mass quantities to distribute. The sick also do not have the time or energy it would take to even do that. I know I don't. We only want a better quality of life. We're not trying to make a quick buck. Please see that we are sick patients, not criminals looking to gain profit. Cannabis has given me hope. When I medicate, I have a quality of life worth living. I cannot emphasize how much cannabis has helped save my life. It's given me hope as I can enjoy life again. I am in much less pain. Please do not let this bill pass without adding Ehlers Danlos syndrome to the qualifying conditions, as well as cultivating our own medications, or our own medicine. Also, May is Ehlers Danlos Syndrome Awareness Month. That was signed by Governor Dayton himself. I thank you for hearing me and taking my testimony today.
Thank you very much for your testimony. Any questions? Mr. Lush?
Well, thank you, Mr. Chair. And Ms. Lee, if you could, offline or somehow, submit whatever you can to me, because it would be my intention to offer that as an amendment on the floor, so that is included, and hopefully it will gain the acceptance of the House.
Thank you so much.
Thank you for your testimony.
Thank you.
Anybody else? Rich, can you just hold? I was trying to get from the families here, if there's anyone